How should you take sedatives to sleep well? Surely you've heard from some people who took Motherwort or Valerian and said, well, we just fell asleep fantastically. But other people talking about the exact same medications, Valerian, Motherwort, said that it's a complete placebo and doesn't work at all. It's all, as the trendy word goes now, fuflomycins, useless medications. If you've ever taken something like Valerian or Motherwort and it didn't affect you at all, please like this video. Let's figure out what's myth and what's truth. Watch this video until the end, and I'll tell you about one herbal medicine that actually works and helps you relax, calm down, and fall asleep. Let's start by defining what sedatives are. We have sedatives, we have sleeping pills, tranquilizers, and antidepressants. So, what kind of class of drugs is this? As a rule, these are herbal medicines or dietary supplements that contain substances like valerian extract, motherwort, lemon balm, passionflower, and several others. As a rule, these herbal medicines contain chemical substances that have a calming and relaxing effect. Why aren't they classified as sleeping pills? They don't actually have a true hypnotic effect. Remember, some people say they took Valerian and immediately fell asleep. But dear friends, the placebo effect works. If a pharmacist tells a customer that a remedy will definitely help them fall asleep, 20-25% of people will go home, take it, and immediately fall asleep, simply due to the placebo effect. You know, I remember Mudrov. He was a very famous therapist, the founder of the therapeutic school, a professor at the Moscow Medical University back in the 1700s. And he had 3 powders, regular, silver, and gold, which helped with a lot of illnesses. The fame of these powders spread all over Russia, and Mudrov himself personally prescribed them. Patients would take them right in front of him, and they worked wonderfully. They reduced fever, relieved pain, and so on. So when Mudrov died and they analyzed these powders, it turned out that all of them were just crushed chalk. And that's why this placebo effect can also work with herbal medicines. By the way, there is also the opposite effect, called the nocebo effect. For example, if you give someone a piece of chalk and tell them it's a strong emetic, 20% of people will immediately start feeling nauseous and will vomit. So this kind of effect also happens. That's why you need to understand that herbal medicines don't work instantly. They're not what you call fast-acting post-stress medications. So, if a person is already stressed and just takes valerian, motherwort, lemon balm, or some other herbal remedy, it won't work anymore. But they have a stabilizing effect on the nervous system, so you need to take them 2 or 3 times a day as a course. And if a person takes the medication regularly, they just get less stressed, they react less to certain situations, they get less agitated, they get less nervous, and overall their nervous system becomes more stable. And accordingly, if this stressful situation doesn't build up during the day, then in the evening the person is calm and physiologically falls asleep better. But once again, this is not a direct sedative effect of the medication, like valerian or motherwort, which cause a sedative effect, unlike classic sleeping pills, antidepressants, and so on. But by the way, this is actually an advantage of herbal medicines, because they don't change the structure of sleep. They don't cause after effects in the morning. Sometimes, when a person takes a sleeping pill, they can't get up or wake up properly in the morning. And it's even well known that all sleeping pills come with a warning. If you've taken the medication, don't drive a car in the morning because it's simply dangerous. In this sense, herbal medicines are significantly safer than sleeping pills, tranquilizers, and so on. But you have to understand that this is more of an anti-anxiety, calming effect, which indirectly produces a sleeping effect. And once again, you need to take them 2 or 3 times a day, and as a course, usually for 2, 3, or 4 weeks, up to a month or even longer. And they gradually develop a cumulative effect, which leads to calming the nervous system and improving sleep quality. Of course, if we have mild stress, we can manage with herbal remedies. Or if it's an acute situation, maybe even add a sleeping pill or a tranquilizer. But if there is a chronic stressful situation, unfortunately, for the past 3 years, our country has been under quite serious stress. This can lead to anxiety, depression, and insomnia. And if insomnia lasts for more than 3 months, then unfortunately, it usually won't go away on its own. Specific treatment methods need to be used. At the same time, as a rule, this kind of insomnia does not respond very well to medication. The most effective method for treating insomnia caused by stress is the so-called cognitive behavioral therapy for stress, anxiety, and insomnia. And now about a medication that helps improve sleep quality, which is of plant origin and contains passionflower. By the way, passionflower is one of the few herbal components that is directly mentioned in the European Clinical Guidelines for the treatment of insomnia. That means there is a high level of evidence that this medication works, and the medication is called Stress-Off. I want to emphasize that this is not a dietary supplement, but an actual medication, because the control over the production of medications is usually much stricter than for regular dietary supplements. Also, as I mentioned, if you take it 3 times a day as a course, it helps stabilize the nervous system and generally provides a good sedative effect. Well, as you can see, I'm talking about some serious pharmacology and also about how you should communicate with doctors and which medications to take. But at the same time, if we're talking about herbal medicines, these are over-the-counter drugs. And if you got a bit anxious, or if your sleep has gotten a little worse, you can buy some calming medications yourself and take them as a course. Of course, it's always better to consult a doctor, but since these are officially over-the-counter drugs, at least read the user instructions and check for possible contraindications. Taking a course of herbal medications will help you stabilize your nervous system and improve your sleep. Subscribe to my channel, there are plenty of useful videos about sleep, sleep disorders, and how to improve your sleep. And be sure to click the bell so you don't miss my new interesting videos.